Good afternoon, everybody. Welcome to Medisage e-learning. On behalf of Medisage, I am Kajal Mukherjee, Manager Strategic Partnership. Happy to onboard you towards the journey of medical knowledge. In Medisage, our endeavor is to reach last mile doctor to empower them through peer-to-peer knowledge sharing and community building. For our today's session, it's my privilege to welcome our expert speaker, Dr. Hussein Kotawala. Dr. Hussein Kotawala is a pediatric surgeon doing both robotic and laparoscopic surgery and also pediatric urologist at Saifi Hospital, Mumbai. Dr. Hussein Kotawala's areas of interest are robotic child surgeries, laparoscopic newborn and pediatric surgeries, pediatric urology and reconstructive surgeries, also pediatric thoracoscopy as well as, to bronchoscopy and bronchoscopy. So we will have a very interesting session with Dr. Kotawala. So without further delay, it's over to you, sir. Kindly introduce.
Thank you for the introduction. Myself, Dr. Hussein Kotawala, and we'll be discussing the few interesting facts, do's and don'ts regarding the minimal invasive surgeries.
Sir, can you come closer to the mic?
Yeah. Am I audible now?
Yes, sir. Yes, sir.
Yeah. Please go ahead.
So, sir, we will have a beautiful session and where I will try to find out what are the things to do in today's session, which is minimally invasive surgery in children. So we call it the keyhole surgery also.
Yeah.
So my first question is, sir, what is minimally invasive surgeries, which is also called keyhole surgeries, and how does it differ from traditional open surgery in children?
Okay. So now in an adult or in children, previously the surgeries were done, and still in some condition it is done with a long incision. Whether it may be a vertical incision or longitudinal incision in front or back to expose the abdomen or any area of interest. With the latest technology, now even in the children, we are able to do the laparoscopy or robotic surgeries. Now, these surgeries are done through the very small holes, like a puncture. Like if you have a tire and if you cut a tire and you suture it, and if you just puncture the suture and you seal the puncture, the strength of the tire remains for the long period, for the years. So, on the similar principle, with the keyholes, very small holes, we approach the body cavities and go ahead with the surgeries. With this, you can achieve the same goal which you are trying to achieve with the open surgery, but with the easy recovery and with less pain. I can't hear you.
Okay, sir. Thank you. So the second questions which are coming my mind, that what are the most common conditions in children that can be treated using keyhole surgery?
Now, keyhole surgeries are mainly designed for the body cavities. For the surface surgeries, uh, logically there is no role. If you want to enter inside the chest or inside the abdomen, then it has a very crucial role in this kind of body cavities. So if you see in the thorax, you can approach the food pipe, esophagus, you can do the lung surgeries, you can do the surgeries for the pus and empyema inside the chest. Now in the abdomen, you can deal with the gastrointestinal system, you can deal with the urology system, you can deal with the reproductive system. So you can deal with the almost all kind of the organs which are available in the abdomen. If you ask me to name simple hernias, undescended testes, appendix surgeries, you have the gastroesophageal reflux, endoplication surgeries, gallbladder surgeries, spleen, liver surgeries, and like in the intestinal perforation, obstruction, and any surgery dealing with the uterus, ovaries in the children, said, like the undescended testes in the boys. So there are the multiple organs which can be approached via 2 to 3 small holes.
Great, sir. So sometimes it comes to the mind of parents that at what age can children safely undergo keyhole or minimum invasive surgeries, and and is there any age specific condition?
So now the science has made so much progress. Previously, say around 30 years back, even the laparoscopy keyhole in the adult was considered as a myth, whether this can happen properly or not. Still, some people has in their mind that with the laparoscopy, with the keyhole surgery, the surgery is not done complete. You have to open always. So this is a clear myth. So practically speaking, as we are advancing, we are getting smaller and smaller instruments, we are getting the better anesthesia facilities. So we have performed, and surgeons, pediatric surgeons all over the world are already performing this keyhole surgeries even in the newborn, in a 2 kg, 3 kg babies, and up to the adolescent, or even the adult surgeon performs. That is going on throughout the long time now. So age is not a specific limitation with the advent of such a great anesthesia and smaller instruments.
Great, sir. So you clearly made it that age is not a constraint
Yeah.
for keyhole surgery. Now, sir, you have already told what is the advantage of minimal invasive surgery, but in specifically in children, what are the main advantage of this minimum invasive surgery or MIS for pediatric patients, sir?
For the pediatric, as you know, you and me as an adult, we are a different people. We can tolerate the pain. We can express our pain. We can approach the people, approach the doctor on time on phone, that we are getting the pain, how to get relieved. But children, newborns, and small babies, they are not that much mature. So we have to make sure that they should be basically mainly pain free. So the early recovery, that's why all these keyhole surgeries made success, because they provide the early recovery, and the children are mostly pain free. Very minimal pain is there, which is taken care of by the simple analgesic like a paracetamol. So that ensures you the early recovery and early discharge from the hospital. So the results which we get, that are very much gratifying, and that makes you to go ahead in this branch more and more.
Thank you, sir, for clarifying it. Now, Caesar, you had already conveyed which are the condition where you can do MIS. But is there any limitation or any specific cases where keyhole surgery might not be appropriate for a child?
Yeah. So now we can't apply the all or none principle in if you are introducing any technique or if you are practicing any kind of surgery. You can't say that it can be performed in any kind of patient. The patient selection is very much important. Suppose it starts from the anesthesia. If the baby is not fit for the anesthesia, say for the open surgery or for the laparoscopic surgery, then definitely you can't go ahead for the procedure. Where from the anesthesia side, in a pediatric surgery especially, anesthesia is more important. We as a surgeon are the mechanic people. So the main role is of the anesthesia, which is provided by the pediatric anesthetic. So if you not fit, then you can't go ahead for the surgery. Now, particularly speaking regarding the surgical challenges, if you have the abdomen which has been operated 5 times, 6 times, then you don't get enough space inside instruments. In that cases, you may opt for the we give a try in such patients also to reach the body cavity and perform it with the minimal scar. But yes, in such conditions, you may take a step back and you may go.
Now, sir, coming to since you are talking about the pain management, so I will come to the next topic as pain management.
Okay,
So,
okay.
how is the pain managed post-operative keyhole surgery in children?
Okay, so now the pain management, doesn't start after the surgery. Pain management starts with the anesthesia. So while the patient, we are inducing the patient, we are preparing the patient for the surgery. At the same time, the analgesics are given through the IV by the anesthetist, and then the area of the interest, we use the local anesthesia to block that part. We make it numb. Even if the patient is under the anesthesia, patient is not able to feel the pain, but we opt to block that pain system. Even even the pain starts to occur. I need to say, before taking the incision only, you make the part numb. So we use the tab block in the abdomen. We use the intercostal blocks in the chest. So it makes the part numb so that the patient is comparatively lesser pain free, almost pain free after the procedure. And even if the pain happens, we use a simple analgesic like the paracetamol or ibuprofen. Usually in a minimal invasive surgeries, we don't require the heavy analgesics even after the procedure.
Thank you very much, sir. Sir, one of the main problem of doing the normal surgery is that the child take a lot of times to come to the normal activity. So my question is that how long it takes, the recovery time takes in MIS, so that the child can return to the normal activity very soon.
So after doing this laparoscopy over the years, what we have experienced, that most of the children in whom the daycare surgeries are done from the small ailments, normally we discharge them in 4 to 6 hours. They go home walking on their own. So minimal pain is that, which I said, which is managed by the oral analgesics. And even if you are performing some major surgery, we usually don't advise the baby to rest. From the next day morning, we ask the parents to make their baby walk so that the parents are more confident, and baby also feels that nothing much has happened to them. There are the very small dressings on their tummy, so they feel nothing much has happened, and it's a small element like a band-aid. It is over there. As I said, they are pain free, so they also feel comfortable in walking around and playing. Usually, we don't keep any kind of the restrictions in most of the surgeries. They are allowed to play, they are allowed to walk around, they are allowed to go to the bathroom on their own. Yeah.
Thank you very much, sir. So now suppose it's normally comes to a parent's mind. So I have decided to go for a keyhole surgery. So can you walk us through a typical keyhole surgery procedure looks like from the preparation and to the discharge, up to the discharge?
So if you ask me from the start, first the consultation with the doctor is important from the proper specialty who is doing this procedure day and night. So they will first step is a counseling. The parent should be knowing everything from the start. What is the disease, how it happened, and what are the multiple. We don't only introduce the keyhole options. We give the parents all the options: open surgeries, laparoscopy, robotic surgery. So they are quite aware, quite counseled, very much comfortable. Okay, what are the multiple options available? We even explain the possible complications of the procedure. We give them the hospital setup idea, and as per the patient is considered, we give them basic investigations to be done for the anesthesia fitness. Then after selection of the hospital, you need to explain them the fasting time, minimum 4 hour, 5 hour for the as per the surgeries. Then during the after the procedure also we talk with the parents what are the care has to be taken, and all the discharge medication is the last step and the follow up. So this is the complete schedule what I should explain on the
yeah. So now we were talking about that. We also talk about the complication. So are there any risks or complication unique to pediatric MIS?
Now, if you are well aware of the anatomy, if your diagnosis is correct, there are hardly very few instances when you get some surprise findings inside the abdomen. So, if from the anesthesia side, all the preparation has been taken, patient is fit for the procedure, you are using the proper camera system, proper, even you are using the 3D system or normal tool instruments are okay, you are well aware of the anatomy, so the procedure is going by the proper norms, and all the orders are followed properly, standard orders are followed post-operative, even after the procedure. And if the patient is going to the ICU, all the ICU staff is aware of the disease which we are managing, then there are hardly, very rarely, any complication occurs. By we can't say the zero complication, but because we are not the gods, so under the capabilities, there are few instances where unknown complications may happen.
Okay, that's great. So that is always associated with any type of surgery. So suppose if you need to prepare a parent and their child, how do you do that mentally and emotionally? How do the parents prepare their child, both mentally as well as emotionally, for this keyhole surgery?
Now the babies are grown up, say above 4 years, 5 years, then it becomes little easy for us. We directly talk with the baby also. We counsel them, we show them the diagrams, we can show them in the books. Now with the social media, lots of the videos are available. In a short, what we are trying to explain the baby also. Okay, this will be with the minimal small holes. You will be comfortable after the procedure. We may ask the parents to take the tour of the hospitals, the bed which we are going to assign to the child. We try to admit the baby sometimes one day prior also if it's a major surgery, so that they get comfortable, get adapted to the environment first, and then particularly for the major surgeries, you need for the minimal invasive surgery. If, for example, you are looking for the robotic procedure, then you need to see whether you have chosen a proper doctor, proper specialty, whether how much volume they are doing, whether that hospital has a proper robotic setup and well equipped ICU requirement is there. So all these things we discuss also, and we ask the parents also if they have the doubt, they can inquire, and so that after knowing everything, we can go ahead and plan for the procedure. And as you said, how you prepare. So this is in a grown-up child, and a smaller baby, we don't have any option to conversate with the baby. So in that cases, our parents are our conveners to whom we explain everything in detail. Yeah.
So actually, you have answered what I was thinking to ask you in the next question, that while selection and hospital, you should always give the preference to where all the proper amenities are there.
Yes, you can't compromise. You can't compromise. Sometimes to limit the budget, you try to go to the hospital where the facilities are not available. In that setup, I ask my parents, you can approach the government hospital. If the patient is not affording, you can't deny that everyone has the right to get the treatment, right? So there are very good government hospitals available where the facilities are available. The patient can't afford at your doorstep, you show them the way, you guide them, rather than doing at a smaller setup and landing up in complications.
Truly said, sir, because it doesn't happen with which hospital they're going, but whatever hospital they're going, they should have proper amenities as well as the trained doctors who can do the robotic or minimum invasive surgery. So, sir, now we are coming to the end of the question, end of the session, where obviously from here we will continue to the next sessions to you. Like, what are the futures of MIS in pediatrics, and is there any emerging technologies coming up, or any innovations has come up which we can look in future?
The future is definitely bright, and that's why you and me are talking over this topic. Because previously, as we discussed, the surgeries which were done in the June season, almost covering the complete length of the abdomen, they are done with a very 3 or 4 holes. So,
Sir, your voice is breaking, sir. Can you once again?
Hello, am I audible?
Yes, yes, sir.
I was saying when the laparoscopy came into the picture, so it was done with a very big instrument. Still in the adult, it is done with the 10 or 12 mm instruments. Now we are doing with the mini laparoscopy, 3 mm, 5 mm instruments. So even in the smaller babies, even the 2.5 smaller instruments are available nowadays. And if you speak about the robotics the old versions had 12 mm, more than a centimeter size of the ports to put inside the abdomen. Now 8 mm, 5 mm are available, and even the companies are looking for now the 3 mm small instruments. So if we have the smaller instruments and miniaturization for the pediatric, so the already this is going on, because the in the future everyone wants the more and more smaller instruments, but without compromising the surgical steps and the results. So already the technology is evolving in this branch. Yeah. So we'll be seeing many good innovations in the future.
So, sir, certainly we will look forward from you since you also do a robotic surgery.
Yes, yes.
So maybe the next session we'll have proper discussions on robotic surgery.
Yeah.
So I also request the audience to keep just follow up our session on Dr. Kotawala, and we will be maybe next session will request sir to talk about our robotic surgery. So,
Sure.
sir, for today, we are coming to the close of this session. And thank you very much for your excellent inputs on this trending subject. I think both the doctors fraternity as well as if it is going to make an awareness among the parents also. And I'm sure audience will benefit from this session and will gather some takeaway points which they can utilize in their day-to-day practice. Sir, we look forward for more precious session like this to collaborate. Okay. As I have already discussed, maybe the next session will be on robotic surgery. So thank you very much, sir. Thanks for your time and thanks for your inputs. Thanks a lot.